Due to the extreme congruency of the hip joint, subluxations are not a practical concern to us. Capsular adhesions and capsular limitations can be taken care of with mobilizations and stretching. So consequently, the only condition that we have to worry about as far as manipulation is concerned, again, is loose bodies. And like loose bodies anywhere else, the same principles of manipulation apply. We'll apply strong traction, and if we pull along the long axis of the leg, that will result in lateral distraction of the hip. At the same time, as the traction is occurring, we'll be extending the hip and simultaneously either medially or laterally rotating the hip, depending on which is indicated. Now, this sounds very complicated to do. In fact, it isn't too bad. The traction and the extension occur with a single body movement, and then we can apply the rotation. However, to do it effectively with enough traction, we have to stand up on the bed, hold the patient's leg, and step away with it. And this is what we'll demonstrate now. The patient basically has to have their top off. Otherwise, there's not enough friction. They'll slide down the bed, and you'll both end up through the back wall. So we have the patient lying supine. We stand up on the bed, holding onto their malleoli. We will then basically step back and down from the bed. And when you're practicing this technique, this is what you need to get first. That step away and down, like so. So that you apply strong traction and extension at the same time. Keep practicing this until you're comfortable with the idea of stepping away from the patient and relying on the patient's tissue to hold together. Move back on the bed again for me, Donna, please. Thank you. Okay, now this time we'll do the step back, so we'll apply the traction, the extension, and this time I'll add on lateral rotation, and then I'll show you medial rotation. So we're up in again the same position, like so. It's a little bit closer, great. And we'll step away and rotate as we come back. So that was lateral rotation. Now we'll look at medial rotation, which is essentially the same, except we turn the leg in the opposite direction. So we're up like so, step back, and rotate as you come down. Thanks. This particular technique is extremely useful. While it does look brutal, it really isn't for the patient. If you're having trouble with the grip or you're rubbing the patient's skin, then use dental dam around the malleoli. It's a very, very effective technique, and it's one that's well worth you practicing for the odd patient that does come in with these loose bodies. Thank you.